Welcome to The Explainer. Today we're going to decode a really important term from the world of pathology, epithelial dysplasia. Sounds complicated, right? Don't worry, we're going to break down exactly how experts spot cells that have started to, well, go a little rogue.
You know, your body is constantly rebuilding itself, cell by cell. It's pretty amazing when you think about it. But what happens when that whole construction process hits a snag? That's really the fundamental question we're starting with here. So here's our game plan for this explainer. We'll start with what epithelial dysplasia even is. Then we'll get into the pathologist's blueprint, looking at both the big picture architectural changes and the tiny cytological details. And finally, we'll see how it all comes together for a diagnosis.
All right, let's jump right in. What exactly are we talking about when we say epithelial dysplasia?
Okay, so at its core, this is something you can only see under a microscope. It basically means the cells that line our body's surfaces aren't growing and maturing the way they're supposed to. They're not following the rules. You might also hear it called intraepithelial neoplasia, which is really just a fancy way of saying new growth happening inside that lining.
Now this is super important. This is not cancer. Think of it more like a warning light on your car's dashboard. It's a sign that something's off, and it's not an on or off switch either. It exists on a spectrum, so pathologists will actually grade it as mild, moderate, or severe to figure out just how far off track these cells have really gone.
So how do they actually spot this? Let's go behind the scenes a bit and see how an expert looks at a tissue sample to make that call. Okay, to make this super easy to understand, let's use an analogy. Picture you're inspecting a brick building. A pathologist is kind of like a building inspector, and they're looking for two main types of problems. First, they step back and look at the big picture. Are the walls wavy? Is the structure sound? That's what we call architectural changes. Then they get up close and look at the individual bricks. Are they all the right shape? Are they cracked or misshapen? Those are the cytological changes. And here it is. This is basically the official blueprint they use. It's based on World Health Organization guidelines, and it lays out all the potential red flags, organizing them neatly into those two buckets we just talked about. On the left, you've got the big picture architectural stuff, and on the right, the nitty-gritty cellular details, the cytological stuff.
All right, let's start with those wavy walls. We're going to look at the architectural changes first, the big picture.
So, when a pathologist is looking at the overall structure, they're hunting for a few key signs that things are getting messy. Are the layers of cells all jumbled up? Has the foundation of the tissue kind of lost its way? They even look for weird things popping up, like these drop-shaped ridges or little keratin pearls where they just don't belong.
Let's zoom in on one of those. See, at the very bottom of the tissue, there's a layer of basal cells. Think of them as the foundation of the building. Normally, they're all lined up perfectly, shoulder to shoulder. But with dysplasia, they start to lose that formation. The connections between them weaken, and the whole foundation just gets chaotic.
And on top of that, that basal layer, that's the factory, the engine that makes all the new cells for the tissue. Well, hyperplasia means that factory is stuck in overdrive. It's just pumping out way too many new cells way too fast. And that just leads to more crowding and more disorder.
Okay, so we've seen the wavy walls. Now, let's grab our magnifying glass and zoom way in to look at the individual bricks to see what's going on inside the cells themselves.
When they're looking this close, it's a whole different checklist. They're asking, are the proportions inside the cell all wrong? Are the cells themselves weirdly shaped? Does the nucleus, the cell's brain, look strange? And is the process of making new cells, of cell division, totally messed up?
Okay, let's talk proportions. In a perfectly healthy cell, there's this nice balanced ratio. The nucleus, the center part, takes up about 1/4 of the cell's volume. So a 1:4 ratio with the rest of the cell, the cytoplasm. But in dysplasia, that beautiful balance is just gone. The nucleus gets huge, it swells up, and becomes way too big for the cell. And that disruption of the 1:4 ratio, that's a huge, flashing red light for a pathologist. It's a dead giveaway that something is seriously wrong inside that little factory. Here's another big clue. When they stain the tissue to see it under the microscope, the nucleus in these cells gets really dark. It's called hyperchromaticism. And what that darkness tells them is that there's too much chromatin, the material our DNA is made of. It's a sign that the cell's genetic blueprint is in overdrive, and not in a good way.
Now this one is absolutely fascinating. It's not just about how the cell looks, but how it acts. We're looking at cell division, mitosis gone wrong. Instead of a nice clean split, you get these bizarre shapes. They call them Y-shaped, X-shaped. It looks like a mess. The actual machinery that copies cells is broken. So you've got the wavy walls, the architectural problems, and the misshapen bricks, the cellular problems. How does a pathologist take all that evidence and come up with a final diagnosis?
Well, it's not about finding just one clue. A pathologist is a true detective here. They have to look at the whole picture, the entire scene of the crime, so to speak. They take all the evidence, both the big architectural stuff and the tiny cellular details, and weigh it all together to figure out just how bad the situation is.
And there's a very clear system for this, which is how they stay consistent. Step 1, identify the architectural changes. Step 2, identify the cytological changes. Step 3, assess the overall severity of everything they found. And finally, Step 4, assign a grade.
And that final grade, that is the absolute key takeaway. It's the final answer from their investigation. By calling it mild, moderate, or severe, they give doctors the crucial information they need to decide what to do next. Is this a watch and wait situation, or is it time for some kind of intervention?
Which, of course, brings us to the big question, right? We've talked about all these abnormal warning signs, but where's the line? How can a pathologist tell the difference between severe dysplasia and something that's already become actual invasive cancer? Now that is a really interesting question, and one we'll have to save for another day.